Okay, welcome to part 2 of abnormal liver function tests. So we're going to be concentrating a little bit on ALT because a lot of the time what happens is somebody just has a routine blood test and they don't really have any symptoms or any complaints regarding the liver area, but they happen to have a mildly raised ALT, and so we sort of have to decide what to do about that. So one way to think about ALT is the sort of severity of it. So if this is the sort of threshold for normal, and they were in the normal range at some point, but then when we do it, it's sort of gone up just above normal. Let's say this is sort of the mild territory, which would be about less than 3 times the upper limit of the normal range. So we don't know if this result right now is just incidental or just one-off, so it's a good idea to repeat it, and so we'd probably repeat it down 3 months down the road, and it comes back slightly improved but still above normal, so it's still an abnormal result. So it depends on the situation, but sometimes they do have it repeated once again, and it sort of stays sort of within this kind of mild range. It can even go to normal and then creep back up again. So the main condition I'd probably think of in this case is something called fatty liver, which is very common and a very common cause for raised ALT. Now, if the ALT was behaving a little bit differently, for example, it was normal and then it shot up very high, then I would think, okay, so there might be something else going on. Then it doesn't seem to fit with fatty liver. So you think of other reasons such as hepatitis, or if there's bilirubin ALP is also abnormal, then you want to rule out other conditions to do with that. So I think if it depends on what the pattern is of ALT and the severity, which helps you make a decision. So in this case, we're going to talk mainly about fatty liver. So when you suspect fatty liver, it's something that is a bit tricky because it's not a one-off blood test or something you can do just to give you a yes or no answer. So there's a little bit of extra kind of work to do to kind of come to this diagnosis. So the first thing I would think about doing is to do a liver screen just to rule out other possibilities. Now, a lot of that time is ruling out Hep B, C, or viral hepatitis. So even though viral hepatitis acutely would give you a very high ALT, so chronic Hep B, C may just give you very slightly mildly raised sort of ALTs. So it's a good idea to check for this. So there are other causes of raised ALT that can be covered in the liver screen. For example, checking the ferritin and iron levels. So for example, hemochromatosis would kind of point towards that direction. The other things you might think about checking is alpha-1 antitrypsin. So that could be checked alongside these other tests. Also for Wilson's disease, you want to check the ceruloplasmin test, I believe it's called. So it's a good idea to do liver screen in fatty liver because you don't want to miss any diagnosis, I guess, and then you can say that once you've ruled out other conditions, then it's likely to be fatty liver. The other thing to check for, which would sort of negate a diagnosis of fatty liver, is alcohol. So if they're drinking above a certain normal amount, then you can't realistically diagnose what's called non-alcoholic fatty liver disease. You can still have fatty liver with that, but to specifically go for NAFLD or non-alcoholic fatty liver disease, you have to basically have a sort of a range of alcohol that's within the recommended guidelines. So that's something to ask about. Now, let's say another aspect of fatty liver is sort of risk factors. So is there anything that's increasing the risk of fatty liver? So you would look at type 2 diabetes, or you'd be looking at cholesterol, obesity. So those are the common risk factors associated with fatty liver. But you have to remember that not all people with fatty liver will be overweight. So it's not something that's it sort of points towards a diagnosis, but it's not gonna completely give you the sort of definitive answer. If they have obesity, then it's probably fatty liver, if you see what I mean. So those are the things I would look at doing in working up somebody with fatty liver. So let's say you've done that, you've done liver screen, looked at their risk factors, alcohol and all of that, and you've kind of concluded that we got somebody with fatty liver. The question is, what comes up quite commonly is, would you do an ultrasound scan? Now, you can do for ruling out certain conditions just in case it's something else, like something within the liver or gallstones, but a lot of the time the ultrasound scan is not really necessary for a diagnosis of fatty liver because the sensitivity is quite low. So the ultrasound can be normal even though you have non-alcoholic fatty liver disease. So doing the scan, the usefulness of that is a bit debatable there. So it's not really that necessary in diagnosing fatty liver. Now, what is the actual issue with fatty liver? If you have somebody with fatty liver, then what would you be worried about, or what would you think? Okay, how would you sort of categorize them? So the way to think about fatty liver is on a spectrum. So you have, starting off, is sort of the non-alcoholic fatty liver disease. So fat is processed within the liver. So if you have increased amount of fat in the liver, that's what is the condition NAFLD. Now, it is quite highly prevalent in the society. So some studies suggest is in 25% of the population have some level of fatty liver disease. So at the mildest level is quite common. But over time, in some people, it can progress. So what you would kind of progress to is something called NASH, which is non-alcoholic steatohepatitis. So that's a bit more inflammation, a bit more progression of this kind of condition. And eventually that can also progress to something called NASH cirrhosis, where there's more fibrosis, more sort of, kind of inflammation within the liver causing cirrhosis. Now, they predict that in future this will be a common reason for liver cirrhosis will be NASH or NAFLD basically. The other aspect of this is all of this is a risk factor for hepatocellular carcinoma. So that's something to keep in mind as well. So in that sort of spectrum of disease with this. So the sort of dilemma is that if so many people have the fatty liver, then, how do you categorize them? Because you can't refer all of them because that would overwhelm the outpatients department. So the question is, which of your patients have fibrosis? Now, you can evaluate this with what's called a FibroScan, now, which is also called transient, I think it's elastography, which gives you a certain, it's like an ultrasound scan to check that, and it'll give you sort of a figure with how much fibrosis is possibly there. But then again, you can't also refer everybody for a FibroScan who you suspect a fatty liver. That is also a bit of a, is quite overwhelming to deal with that. So what's been sort of developed as a risk stratifying tool is a further blood test that can be done, which they have different names. So there's something called ELF, extended liver fibrosis blood test, or there's the FIB4 score, which is also a blood test. Now they take into account different things like platelets, AST, and other things, I'm sure, that would be included in that to give you a certain, mild, moderate, or high risk. So what you would have to do is, dependent on these blood tests, you would say the high risk people, it's a good idea to refer them earlier. The sort of moderate risk, you can try to get a FibroScan organized, and the sort of low risk, you want to address their risk factors and do, just monitor them a bit more on a regular basis. So with fatty liver, is the sort of take-home points is that you do sort of want to do these additional tests to see if they need anything doing further at this stage. And another point is that it's very common, and is a common reason for mildly raised ALT. So it's something that you'll definitely encounter quite often. Alright, so thank you very much. And so I'm going to also do another part 3, which looks at conditions related to ALP rise more so than ALT. So there's a few more bits to do on that.